my name is Gavin. I'm an apprentice at Multicultural Arts and Media Centre Rochdale. We're here at the NHS Innovation Expo 2015. We've just listened to a discussion from the NHS Youth Forum with guest speakers about issues young people face within the NHS and how they can be improved. I look forward to looking around at all the stalls here with new innovations, how services are going to be improved for young people especially within the NHS.
Hi, I'm Amy. I'm delighted to see so many people here to discuss, does the NHS meet the needs of children and young people? Children with learning disabilities, mental health needs and physical needs all reported poorer experiences of inpatient care, and I myself can vouch that I reported poorer quality inpatient care. How can we change this, and how can we ensure the services delivered to children and young people really meet their needs and are person-centred?
How can we ensure that it's person-centred? I think it's about listening and it's about responding. So I think one of the dangers that we have in NHS is that we assume people know what others want.
The learning and the listening is absolutely critical, but taking it one step further forward, which is being the advocate, continually being the advocate for children and young people. As Al said, we would appear within this country not to give children the priority we should. So it is all of our jobs to continue to advocate for children and young people and to recognise that their voice is absolutely critical.
I really welcome this event. It's the first time in my 42 years of working with and for children there's been such a high-profile event involving the voice of children and young people. So well done, and this cannot be allowed to be a one-off event. I'm going to be pretty provocative. And the context which colours everything we're talking about is England is one of the most child-unfriendly countries in the developed world. And I can give you hard evidence for that, not least from the light of my own extensive international experience now of travelling and seeing how children and childhood are seen in different countries compared to us here. Having said that, in my 42 years there has been a transformation in children's health services. We have new treatments. Leukemia was incurable when I was a medical student. We have fantastic prevention programs. Look at meningitis only this week, a really successful program, and most children by and large are pretty healthy, and that's something to be celebrated.
And we're really excited that today is the kind of almost the first outing. They had a little sneaky outing, these posters, at the school nurses conference, but this is the first outing of these posters, and it's just in time for a new school term, which is just fantastic. So our ambition, obviously there's some printed versions here that you guys can all take away, take them back to your schools, take them back to your hospitals. But what we're going to do in NHS England, and the Youth Forum works a lot electronically because there's 25 of them, but they've got a massive reach of network to thousands of young people in their community.
Hi, I'm here with Danielle and Gavin at the NHS Expo 2015. We've just sat through a talk with the NHS Youth Forum about young people and children's services within the UK. It was very interesting to listen to. I'm looking forward to exploring all the different stalls that we've got around us at the minute and seeing what else I can learn and find out about.
This is basically a session with 5 completely committed people who are doing different things to change totally the way mental health progresses in this country. So if I start, I'm Geraldine Strachty, I'm the National Clinical Director for Mental Health. And what I want to tell you about really is what's the national policy, what is the national thrust in mental health. So basically we have a 4-part national mental health movement. I describe it as the social movement for mental health, not mental ill health, mental health. And we have 4 major strands that we're doing.
The case that Geraldine made has been accepted in Greater Manchester because it took almost no time at all from the opportunity of devolution landing in Greater Manchester and for Greater Manchester to start to think about what its kind of priorities were in first maximising our potential for health gain across a population of 2.7 million people and ensuring that all of our population was connected to the benefits of the economic growth that we expect to deliver through Greater Manchester. And with those 2 headlines, actually the analysis is quite sound on why mental health would become preeminent amongst our sort of starting priorities. So the work that started to emerge from the National Task Force and the Treasury deep dive absolutely confirmed the case that we suspected, that the potential both financial and health outcome benefit of a radical and significant new approach to early intervention and prevention for mental health would be one of the most significant contributors to long-term sustainability across the health and care system.
Mohammed Sawa from Multicultural Arts and Media Centre. We had the opportunity to work with the SEN on a couple of projects, which we are very proud to learn from, and my young people who have been benefiting today. Fantastic event for the past 2 days. I've been attending workshops, etc., meeting lots of people. And this is not being negative. I think we're costing the NHS service for the simple reasons. It is the engagement side. I don't know why I have to go everywhere to mention about the BME. Because 2 days, I've not heard it from the professionals, I've not heard it from the service providers, and I've not heard it from the people attending. So I feel a bit out of place, one reason. Secondly is what are we actually doing in terms of real engagement with the BME community? We need to be providing employment to the senior people to be able to make that difference. Otherwise, if we're just representing as professional volunteers on strategic boards, but we can't do anything about it because money will count. You know, it's the resources that we need to put into there and make sure they are brought on board, not as a separate community, because it's one issue for everybody. You know, why they have to be isolated? So I think within the consultation, within the resources, and what are we actually doing is an impact. You know, as commissioners, have we actually evaluated what we've been sort of putting out in terms of money and resources? What actually impact has it made? So we need to monitor that and make sure that we are making that difference. Thank you.
So with regards to yours, why you have to be the BME person asking the BME question, very good question, but sadly I think what we have to do more is have people like yourselves and people like myself as well. I'm standing up here and Janet's here and Julie's here. I constantly remind people about the issues around seldom heard groups. And I do include BAMEs as a seldom heard groups, but I also include homelessness as a seldom heard groups because they're not a voice neither, and neither are learning disabilities. So we do have the most vulnerable and seldom heard groups that, and you're absolutely right, the more we talk about it, in fact, Warren and I were talking about the voluntary sector, how do we engage that from a devolution agenda, and we've got some ideas, and people like yourself and others will help us to shape that and move that forward.
Hello, my name is Julie Cheetham, and I'm the Deputy to the Associate Director for the Greater Manchester, Lancashire and South Cumbria Strategic Clinical Networks. In my portfolio, we work quite heavily with children and young people, and we also have, as part of that work stream, is maternity and children. So within the maternity and children network, we also have CAMS, which is children and adolescents with mental health issues, and we look to develop our CAMS strategy and our work plan. So the question that you asked me was around how do we engage. Well, part of our engagement is through our clinical leadership, and that is Dr. Sandy Renaud, who is our clinical leader. We have a work programme that covers the whole of CAMS, but probably what we're not doing strongly enough is how do we bring our wider community together as within children. So looking at BME communities, we link quite heavily with the youth parliaments as well. So we're trying to involve as many people as we can in our work programme, looking from eating disorders all through to ADHD. We're going to present a new strategy in the coming months, and we'll have a launch in December, of which we'll invite the Youth Parliament to come along and young people to be part of that, along with our clinicians.
Good afternoon, my name is Dr. Cal Ewing. I'm a local paediatrician. I work at the Royal Manchester Children's Hospital. I'm also the Vice President for Health Policy for the Royal College of Paediatrics and Child Health, and I'm also an advisor to the Greater Manchester, Lancashire and South Cumbria Strategic Clinical Network. My role is very much on the shop floor. I meet with children and young people from a variety of diverse backgrounds and cultural backgrounds, and I feel absolutely passionate about making sure that their needs in terms of their healthcare are met by professionals such as me. So I do it on the ground, and secondly I do it as Vice President for Health Policy by making sure that I work collaboratively with other policy organisations such as NHS England to deliver participation. We've got an excellent participation forum at our college. It's called the Youth Advisory Panel. We also have a parent carers group, and we're hoping to expand that to extend to hard to reach groups. That's currently underway at present.
Hello, my name's John Herring. I'm the Network Manager for Cancer for the Strategic Clinical Network, and I'm based in Greater Manchester and Lancashire in South Cumbria. I guess my role is to link up cancer services to make sure that we improve what we offer patients, and we do that by linking up clinicians and getting clinicians to advise the people who buy our services. So that's clinical commissioning groups and specialised clinicians. So we get that advice back to them via clinical leads. In terms of involving patients and getting the patient voice in there, we've got patient groups associated with cancer. But in addition to that, we ran a national cancer patient conference this year, trying to get patients involved in knowing what they can influence in the NHS agenda. And some of those patients were young people. We had the Christie crew come along and talk about how you can involve young people more in cancer services. And they've done some great projects over the years in terms of involving young people and making sure that services that are designed for young people meet young people's needs. I think reaching out into the ethnic minority communities is a real challenge for cancer services. We know that people from black and minority ethnic groups have worse outcomes for cancer. And in fact, not just that, but also regions. So in Manchester, North Manchester people have a far lower survival rate and a lower detection rate than people in South Manchester. So it's also a demographic and economic split. So I think there's real challenges for us there in reaching out into those communities to make cancer services more accessible for them, to enable people to feel as though they can come forward, and when they come forward that they get detected and treated as quickly as possible.
Hello, my name is Will Adams and I'm Deputy Member of UK Youth Parliament for South Cumbria and also a member of the NHS Youth Forum. So I've kind of been at Expo for a couple of days now, and this morning I was on the main stage over in the the innovation stage, and I presented some questions to 4 children and young people's champions, which was absolutely fantastic. Met some really inspirational people, and as a young person I've got out of this event that young people really do want to be heard, but that some of these groups find it quite difficult to get involved with us, and so from this event I'm going to take away that maybe we're taking ourselves for granted a little bit, and maybe we need to put ourselves out there a little bit more and advertise ourselves to say, hello, we are the young people of the NHS.
Hey, my name's Vas. I'm a volunteer for NH Youth Service and Derby World Hospital, so I'm a trained youth worker. I'm also part of NHS England. Please follow us on Twitter. So I guess I'm just trying to publicise what we do and publicise what we're doing at Expo, seeing what everyone does. So how you're on the main stage, how the two of us doing a uni pop-up session. So that was very interesting, meeting lots of new people, trying to get contact. And I guess that what you said, just to summarise that, adults kind of want us, they want our opinions, and they want to know what we think, and yeah, what we said, we are tomorrow's future. So.
Hello, my name's Megan and I'm also in the NHS Youth Forum, and I'm also representing the Dudley Health Watch project. I think that it's been a really good opportunity to be here. It's just like there's so many different people that you can mix with, and everyone's been so like welcoming with us, and they've spoke to us and they've actually listened to what we have to say, and I think it's been really good.
Hi, my name's Gavin. from Multicultural Arts and Media Centre in Rochdale. We're here today at the NHS Innovation Expo. I think it's been fantastic. With quite some major topics of discussions this morning on the innovation stage. So it's been a great opportunity to take part in workshops and learning more about NHS services.
Hi, I'm Sarah. I'm from MEMC. I'm part of the Youth Help Project. It was really good to see all the different stalls and things that are on today, learning about all the different things that are available for young people, as well as interviewing people about what they can do to further young people's participation in their services so that they can find out more about them.